You are here once again from just about every continent on the planet, from the Americas to Japan and India, from Canada to the UK to Africa, to learn, to exchange ideas, to exchange information, to forge new partnerships, all to create a healthier world for all of us. We never began the issue of seeing global health as a commitment for our state, believing you could do it alone. Instead, we have, from the very outset, said this is a partnership with our colleagues around the globe to see if we can't make dramatic improvement in global health.
The mission of the Pacific Health Summit is to connect science and policy for a healthier world. And we believe that the key to a healthier world is to prevent, detect, and treat disease early enough to keep people healthy and dramatically reduce the human and financial cost of disease. And to help us make that dream a reality, we invite top leaders to Seattle every June to tackle a major issue in global health. This year, as you well know, our theme is the Global Nutrition Challenge. It would be easy to become discouraged by the complexity of the challenges that are converging on us: rising food prices, energy costs, environmental threats, as well as the immediate health threats of communicable and non-communicable diseases. This crisis also helps us bring attention to the centrality of nutrition as a key component for helping us make the future healthier. And as we saw last year, the summit is a place where initiatives can be launched and the results achieved. And with the people and organizations in this room, we have the energy, resources, and capability to invent a healthier future.
I think it's really important for us all to be aware that nutritional science is on relatively weak footing, and that a lot of the things we believe probably aren't true, just because it's so hard to do nutritional science. There's a lot of data that correlates in a sort of epidemiological way health with lifestyles and eating and things that we tend to develop our prejudices from. But as we've learned over and over again in the field of public health, a lot of times we're wrong from those kinds of correlations, and that it's only when we do randomized trials that we find out for sure what's going on in a human population. And that's, as you know, extremely difficult to do with respect to something like diet, where people don't want to change their diets. You notice it because people have such almost religious beliefs about nutritional matters. And whenever a field gets that way, it's often because the evidence is relatively weak. Perhaps one way that we can do better is just to take advantage of natural changes that take place and do a much better job of tracking the consequences when they occur, when economies change, when people move, various kinds of things. And we now have the potential to do that with current IT technologies and the willingness of people to report online, what they're doing, what they're experiencing. I think that's a very important future for this field. In fact, some of the most important data that we have on the role of cancer, nutrition in cancer, comes from studies of immigration, where people have changed their lifestyle and their diets, and we see correlating changes in cancer.
The science of nutrition has got a long way to go, but science is starting to reveal some important secrets. And of course, genetic variation turns out to be an extremely important influence on body mass. And if you take identical twins who've been separated at birth, brought up differently, and you look at their body mass index later in life, it is remarkably similar. So there are very powerful genetic influences on health, on body mass, depending on the environment and food availability. And it's turning out that genetic variation is important at both ends of life. We also see through studies of our genes about what an important natural selective pressure food has been on human evolution. Now, the challenge, of course, is that the balance of energy intake and expenditure has changed. In the case of obesity, there are some huge challenges that face us. So how do we tackle the combined problem of reducing food intake and increasing energy expenditure? And these are not either-or problems. It's a bit too easy for people who work on one side, well, it's all the other side's problem. We're going to have to tackle both intake and expenditure as well. We need to foster interdisciplinary research on energy balance. We need to study the importance of the built environment and transport. And these are very difficult things to do. We need to work with food manufacturers. We need to move from highly palatable, calorie-rich, high portion size, cheap foods which sell well, to palatable food which has balanced nutrition, there's better portion control, and it's affordable. So we can't take away choice, but what we need to do is to offer a better choice of food. We need to use policy change as an opportunity to actually collect evidence on what are effective public health interventions.
There are 10 million children that die each year, mostly in the developing parts of the world, mostly from preventable or treatable causes. 35% are said to be dying from malnutrition. As many as 40% or more children who survive actually are born stunted. There are some things that are very clear. We've got to continue doing what works. And for that, we need strong commitment by governments and the creation of national policies that support food fortification. There have to be strong partnerships, like the Grameen Bank and Danone, like the Kiwanis and UNICEF, between the public and the private sectors. Partnerships are required for this to work. And there have to be new sources of funding, but we're not talking billions and billions. This is a relatively modest need, and there's no reason why we can't come up with the funding to address the problem. On the science front, much more needs to be known about the fundamental basis of action of micronutrients and what we don't know about what we don't know regarding micronutrients. I think it's very important that when we talk about nutrition, we are talking about not only science, not only the development of products, but it's really the technology and science of delivery that we have to understand. Delivery has many aspects to it. I think if we work together, we can solve many of the problems of nutrition. This requires partnership, resolve, and commitment.